Today I am going to talk about lymph node swelling. So what is lymph node? So lymph node is a component of our blood formation system that is called hematolymphoid system, which is present inside in the neck, in the axilla, in the abdomen. So everywhere lymph node is there. It is normally present in normal person, and this is important for our body immune defense system. So this cells produces defense system to our body. So whenever there is a swelling happens, it can have many causes. So whenever a person develops some kind of, like suppose sore throat or some fever, they develop lymph gland swelling, because at that time the body requires a lot of cells to defend this infection. So the lymph node get enlarged, and once the infection gets subsided, the lymph node become normal in shape. So when this swollen lymph node persists despite after completion or reverberance of this fever or any infection, then that is called pathological. Or sometimes you will have a lymph node swelling which is not associated with any fever or anything. Some weight loss is there, patient is not eating well, something is there. So then it is pathological. So that needs to be investigated. So lymph node swelling, the most common cause in our country, in India, is tuberculosis. So whenever a patient comes with a lymph node swelling in the cervical region or axilla or abdomen, anywhere, we first try to look into the clinical history of the patient, like if any family member is suffering from any chronic infection like tuberculosis, or any time in past he has been treated for that. If that is not, then you do some special investigation. So the first and foremost investigation, whenever there is a persistent lymphadenopathy, what does that mean? So persisting for more than 2 to 3 weeks, not responding despite oral antibiotic, that should be investigated first by FNAC. In around 80 to 90% of the cases, by doing a simple fine needle aspiration cytology, we can get a diagnosis what is happening inside the lymph node. And if there is a suspicion that some major problem is happening, or sometime in 20% of the cases, if you are clinically convinced that some problem is there but still you are not getting a diagnosis, then we do a total excision biopsy or a true cut biopsy. And in our hematology specialty, the two most common causes of lymph node swelling, that is lymphadenopathy, is lymphoma that is called Hodgkin's lymphoma and non-Hodgkin's lymphoma. Hodgkin's lymphoma generally happens in the younger age group, and non-Hodgkin's lymphoma happens in the older age group. And these two lymphomas are very much curable and controllable. So that's why early detection of any lymph node swelling, the etiology has to be investigated and should be properly treated. So one should not neglect any lymph node swelling which is persisting for more than 2 to 3 weeks or increasing in size, with associated weight loss, with associated low-grade fever, which is not being explained by any other possibility. Then one should get investigated by appropriate doctor, and one should get the proper diagnosis of lymph node swelling. So lymphadenopathy should be investigated when it comes to your clinical examination. Thank you.